The COVID-19 pandemic has taken a toll on every individual by the means that we are still, till date, encountering new series of clinical features. Now, while respiratory symptoms, they still dominate the clinical picture and are mainly responsible for the mortality, the other body systems are also equally involved to a variable degree. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I'm going to talk about a very interesting case study of a COVID-19 induced neurological manifestation. A recent study in the Journal of the Associations of Physicians of India reported a 69-year-old female patient who was admitted with high-grade fever for 5 days along with gradual drowsiness for 3 days. She had no episodes of seizures, and at presentation the patient was restless, responding partially to commands and had urinary retention. The SpO2 was 96%, the plantar response was bilaterally flexor. In view of the ongoing pandemic, COVID-19 was hence tested. A CT scan of the brain was apparently normal. So after the test results came out, the patient tested positive for COVID. As initial blood culture was negative and lab reports including the procalcitonin, typhidot, the IgM, malaria antigen and scrub typhus IgM were all negative, the present illness was presumed to be entirely due to COVID infection. So the patient was started on IV dexamethasone and IV remdesivir, as till then it was approved for use in COVID. Associated supportive care like the low molecular weight heparin was also started, but no antibiotics per se was given. By the second day of treatment, the patient became fully conscious and communicative. Her catheter could also be removed. Thus, the diagnosis of Covid encephalopathy was made. Thereafter, following the temporal profile of illness, a case of myositis was also added due to the COVID-19 infection. The electromyography showed the presence of fibrillations. The remdesivir treatment was stopped after 5 days. IV dexamethasone, however, was continued for a total of 10 days. She had gradual decrease in muscle pain. Finally, at discharge, the patient was fully conscious with no residual neurodeficit. She could also walk out of the hospital, although there was some weakness that still remained. At follow-up, after 1 month, she had no residual muscle weakness. So till now, the SARS-CoV-2 has rarely been associated with encephalopathy. So this was one of the earliest cases. But in this patient, the positive factor was that the respiratory involvement was minimal. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.